Erectile dysfunction is more common than you might think, and it's not just about aging. But how do doctors actually figure out what's causing it? Today, we're going behind the scenes of the diagnosis process, step by step, so you know exactly what to expect if you ever face this problem. Let's get started. Chapter 1: Introduction and Breaking the Stigma. Erectile dysfunction, or ED, affects millions of men worldwide. Causes range from stress and hormonal imbalances to heart disease and diabetes. Many men avoid seeking help out of embarrassment, which only delays proper treatment. Remember, ED is a medical condition, not a personal failure. Early diagnosis can lead to faster recovery. With 2. The first step: medical history. Your doctor will start by asking detailed questions about your symptoms. How often does it happen? How long has it been going on? Is it sudden or gradual? They'll review your lifestyle, smoking, alcohol, stress, and relationship factors. They'll also ask about other health conditions, like diabetes, high blood pressure, or depression. Honesty is key. Hiding details can delay finding the real cause. Chapter 3: Physical examination. A quick but important step. Your doctor checks genital health for signs of injury or abnormalities, penile structure for curvature or scarring, like Peyronie's disease, testicle size and firmness, which may point to hormonal issues, blood pressure, heart rate, and BMI, because they're further enjoying the International for lab tests and blood work. To uncover hidden medical issues, doctors may order blood sugar tests to check for diabetes, cholesterol and lipid profile to assess heart health, testosterone levels to detect hormonal imbalance, thyroid function tests to rule out thyroid disease. Sometimes, urine tests are done to spot early kidney or metabolic problems. Chapter 5: Specialized diagnostic tests. If basic tests don't give answers, your doctor might suggest the nocturnal penile tumescence test, which measures erections during sleep to see if ED is physical or psychological. Doppler ultrasound to check blood flow to the penis. An intracavernosal injection test, where medication is injected to see if an erection can be achieved. Neurophysiological tests to examine nerve signals. Chapter 6: Psychological evaluation. Mental health plays a big role in ED. A psychologist or psychiatrist might assess for anxiety, depression, or relationship stress. If ED is psychological, therapy can sometimes be more effective than medication. Chapter 7: The final step: diagnosis and treatment plan. After all results are in, your doctor will explain the cause of your ED, whether it's physical, psychological, or both. The best treatment options: lifestyle changes, medication, therapy, or a combination. Slight emphasis. Good news: most men see improvement once the right cause is found. And call to action. If you're dealing with ED, remember, you're not alone. There are proven ways to treat it. Talk to your doctor and take that first step. For more health tips and honest medical talk, Hit subscribe and stay informed.